Before you place a clove under your tongue tonight, stop for 10 seconds. Because the tiny brown spice in your kitchen may be useful, but the viral promise attached to it could make you ignore something far more important. You may have heard that one clove beneath the tongue can open your arteries, thin your blood, sharpen your mind, balance your sugar, and restore youthful circulation in only 5 minutes. It sounds scientific, it sounds effortless. And when your hands are always cold, your legs feel heavy, or your energy disappears before lunch, it is exactly the kind of promise you want to believe. But here is the question no one in those dramatic videos asks. If one clove truly worked like a fast heart medicine, why would its dose, purity, medical interactions, and safety not matter? And why do some people feel warmth or tingling in the mouth, while nothing meaningful has been proven to happen inside their arteries? Today, I am going to show you what may actually happen when clove touches the tissue beneath your tongue, which benefits are biologically possible, which claims are exaggerated, and which warning signs should never be covered up with a kitchen remedy. Stay with me, because near the end I will reveal the one mistake that frightened a 68-year-old man named Thomas more than his cold hands ever did. His story is fictional, but it is built from situations doctors see every day. It may help you recognize a dangerous misunderstanding before it reaches your own home. My name is Dr. Ryan Coldridge. For years, I have helped older adults separate useful health habits from confident-looking misinformation. I do not believe every natural remedy is useless, and I do not believe every traditional practice should be mocked. Clove is a remarkable spice. It contains aromatic compounds, especially eugenol, that researchers have studied for pain, oral sensation, inflammation, microbes, and several laboratory effects. But a compound showing activity in a dish, a cell, or an animal is not the same as one whole clove producing a medical breakthrough in a human being within 5 minutes. That difference is where truth lives. If you appreciate calm, evidence-based health information for people over 50 and 60, take a moment to like this video and subscribe. It helps this message reach someone who may be replacing real medical care with a viral shortcut. And tell me in the comments, have you ever placed a clove under your tongue, chewed cloves, or used clove tea? Your experience matters, but remember that a personal experience cannot prove what caused a change. Thomas was 68, retired from a city bus company, and lived alone in the small home he once shared with his wife, Margaret. Every morning, he made tea in the same blue cup she had bought him on their 30th anniversary. Since her passing, routines gave his days shape. He watered the roses, fed a neighborhood cat, and called his daughter on Sundays. But over several months, he noticed that his feet felt cold, even when the room was warm. Walking to the mailbox made his calves tighten. Some mornings he felt foggy and strangely tired. Thomas did what many people do. He searched for an easy explanation. One evening, a video told him that sluggish circulation after 50 could be rebooted by placing one clove beneath the tongue for 5 to 7 minutes. The speaker described an express lane into the blood. He promised widening arteries, thinner blood, clearer thinking, and better energy. Thomas looked at the jar beside his stove and smiled. The answer seemed almost too simple, but simplicity was exactly what he wanted. No appointment, no uncomfortable tests, no frightening conversation about his heart. The next morning he placed a clove under his tongue. Within a minute he felt warmth, tingling, and mild numbness. "It is working," he whispered. After 5 minutes he stood up and believed his mind felt brighter. The sensation was real, but his interpretation was not necessarily correct. Warmth inside the mouth can occur because eugenol interacts with sensory pathways that respond to irritation and temperature. A tingling or numbing feeling proves that the mouth has detected a chemical. It does not prove that blocked arteries have opened, that circulation throughout the body has improved, or that the heart is suddenly under less strain. This distinction is essential. Your body produces sensations quickly, and your brain naturally creates a story around them. Mint makes the mouth feel cool, but it does not lower the temperature of your blood. Chili makes the mouth feel hot, but it does not mean your internal organs are burning. Clove can create warmth, stinging, tingling, or numbness, yet those sensations are not a home circulation test. Now let us examine the strongest part of the viral claim, the area beneath the tongue. Yes, the sublingual tissue contains many small blood vessels. Certain medicines are deliberately designed to dissolve there so they can be absorbed rapidly and partly avoid the digestive system and first-pass liver metabolism. This is why some specifically formulated drugs are prescribed for sublingual use. But that scientific fact does not automatically turn every food, herb, seed, or spice held under the tongue into a fast-acting medicine. A manufactured sublingual tablet has a measured dose, a known formulation, predictable dissolution, and testing that tells clinicians how quickly and reliably the drug enters the body. A dried clove is different. Its size varies. Its eugenol content varies. The amount released into saliva varies. How long it stays in contact with the tissue varies. Some of it may touch the mucosa, some may remain trapped in the plant material, and some will be swallowed. There is no good clinical evidence that one whole clove held under the tongue for 5 minutes reliably delivers a therapeutic dose that improves circulation in older men. You may also hear that swallowing a clove destroys 80% of its benefits in the liver. That precise number should immediately make you cautious. Eugenol taken by mouth can be absorbed and then rapidly metabolized, largely into conjugated compounds that are eliminated through urine. But metabolism is not simply the body destroying benefits. It is one of the ways the body processes foreign chemicals. More importantly, the existence of metabolism does not prove that a whole clove under the tongue bypasses it enough to produce a heart effect. A confident percentage without a matching human study is decoration, not evidence. Now let us address nitric oxide, because this is where many videos become especially convincing. Nitric oxide is a signaling molecule produced by the lining of healthy blood vessels. It helps vessels relax, supports normal blood flow, and responds to exercise, diet, and many internal signals. Because nitric oxide is important, almost any ingredient connected to it in a laboratory can be advertised as an artery opener. But the missing question is dose. A cell exposed directly to eugenol in a controlled experiment is not the same as an older adult holding a dried clove beneath the tongue. The concentration reaching the blood may be different, the timing may be different, and the effect may be too small or inconsistent to create a meaningful clinical change. This is also why the phrase, peak in 15 minutes, should be treated carefully. Peak concentration depends on the substance, formulation, dose, route, and person. A standardized medicine can be tested repeatedly to establish that timeline. A whole clove cannot be assumed to follow the same schedule simply because the mouth is vascular. Human research shows that swallowed eugenol can be absorbed and metabolized, but it does not give us a proven stopwatch showing that one clove improves mental clarity, heartbeat, glucose, and circulation at exactly 15 minutes. Expectation can also shape what you notice. When a trusted-looking presenter tells you that clarity will arrive, you begin scanning for clarity. You may sit quietly, breathe more slowly, avoid checking your phone, and focus on your body. Those actions alone can make you feel calmer. The improvement is not imaginary. The cause may simply be different from the one advertised. This is known as an expectation effect, and it is one reason controlled studies compare a treatment with a placebo instead of relying only on testimonials. A testimonial can begin honestly. I tried it and felt better. The mistake appears in the next sentence. Therefore, it opened my arteries. Feeling better matters, but it does not identify the mechanism. Maybe the person rested. Maybe the symptom naturally passed. Maybe the strong taste increased alertness. Maybe breakfast, hydration, sleep, or medication played a role. Good science does not insult personal stories. It asks what else could explain them. The goal is not to strip hope from natural health. It is to place hope on stronger ground, where food supports health, medical care addresses disease, and no promise prevents you from asking for the help you deserve. What about the claim that the first 5 minutes trigger vasodilation throughout the body? Blood vessels widen and narrow constantly in response to temperature, activity, hormones, nerves, oxygen demand, medications, and disease. Researchers have explored eugenol's effects on biological pathways, and laboratory work can help generate useful questions. But there is a major gap between a compound influencing cells under controlled conditions and a single kitchen clove rapidly improving blood flow in a person with diabetes, high blood pressure, narrowed arteries, anemia, thyroid disease, or heart disease. If your feet are cold, the cause may be as simple as a cool room, but it may also involve reduced activity, nerve damage, circulation problems, medication effects, anemia, low thyroid function, or other conditions. If your calves ache or tighten when you walk and improve when you rest, that pattern deserves medical attention. A clove may change the taste and sensation in your mouth, but it cannot diagnose why your legs are struggling. Thomas did not know this. For 2 weeks, he repeated the ritual every morning. He began telling his daughter that his circulation was improving, yet he quietly shortened his walks because the calf discomfort was getting worse. He stopped mentioning it because admitting the symptom would threaten the hopeful story he had chosen. This is one of the most dangerous effects of an exaggerated remedy, not always direct toxicity, but delayed action. A person feels that he is treating the problem, so he postpones finding out what the problem actually is. Then came a Saturday morning Thomas would never forget. He walked to a nearby shop to buy milk. Halfway there, the tightness in his calf became stronger than usual. He slowed down and leaned against a fence. He was not having a dramatic movie scene. He was simply frightened by the realization that his body had been warning him for months. A neighbor drove him home, and his daughter insisted he make an appointment. At the clinic, Thomas expected the doctor to criticize him for using cloves. Instead, the doctor asked a gentler question. "What were you hoping the clove would fix?" Thomas looked down and said, "I was hoping it meant I did not have to be afraid." That answer changed the room. He was not foolish. He was grieving, lonely, and terrified of losing his independence. The viral promise had not merely sold him a spice trick, it had sold him relief from uncertainty. His evaluation suggested that the leg symptoms needed proper vascular assessment, along with a review of blood pressure, blood sugar, cholesterol, activity level, and medication. The lesson was not that every cold foot means a blocked artery. The lesson was that persistent or exertional symptoms should be evaluated rather than explained away by a sensation beneath the tongue. Now we need to talk about blood thinning. Some laboratory studies have found that eugenol or clove-related compounds can affect platelet aggregation under experimental conditions. That may sound like a benefit, but less clotting is not automatically safer. Platelets help stop bleeding. A substance that influences them could matter differently in someone who takes aspirin, clopidogrel, warfarin, apixaban, rivaroxaban, or another medicine that affects bleeding or clotting. The amount from normal culinary use is not the same as concentrated oil or supplements, yet the larger principle remains. Do not treat a possible interaction as a bonus. If you bruise easily, have a bleeding disorder, are preparing for surgery or dental work, or use blood-thinning medication, speak with a qualified clinician before turning clove into a daily therapeutic routine. Never stop a prescribed medicine because a video calls a spice nature's blood thinner. Your prescription has a specific purpose, dose, and monitoring plan. A clove does not replace that. The same caution applies to blood sugar. Clove and eugenol have produced interesting findings in laboratory and animal research, and some human research has studied standardized clove-derived extracts or related metabolic markers. But those results do not establish that one whole clove beneath the tongue will regulate glucose within minutes. Blood sugar after a meal is influenced by the meal itself, insulin production, insulin sensitivity, muscle activity, medications, sleep, stress, illness, and many other factors. If you have diabetes, the feeling of sudden clarity after tasting a strong spice does not tell you whether your glucose is high, low, or normal. Only an appropriate measurement can do that. This matters because symptoms such as sweating, weakness, confusion, shakiness, or dizziness can require prompt attention, especially for someone using insulin or glucose-lowering medicine. Do not delay checking your level or following your care plan because you are waiting for a clove to work. What about inflammation and joint pain? Eugenol has shown anti-inflammatory activity in experimental settings, and cloves contribute flavor and antioxidant compounds to the diet. That is reasonable. What is not reasonable is promising that a 5-minute sublingual ritual will shut down inflammation throughout the back and joints. Chronic pain has many causes. Arthritis, muscle weakness, nerve irritation, poor sleep, inactivity, injury, and inflammatory disease require different approaches. A spice can be part of food without becoming a universal treatment. You should also understand the difference between a whole culinary clove and clove essential oil. Essential oil is concentrated. Concentration changes risk. Undiluted clove oil can irritate tissues, and high-dose ingestion of eugenol-containing oil has been associated with serious toxicity, including liver injury. Never copy the whole clove ritual using drops of essential oil beneath your tongue. More is not better, and natural does not mean harmless. Even a whole clove can cause problems for some people. It may irritate the mouth, gums, or tongue. It may trigger burning, soreness, an allergic reaction, coughing, or choking. Holding a small hard object in the mouth may be especially unwise for someone with swallowing difficulty, reduced sensation, tremor, cognitive impairment, or a tendency to fall asleep while using it. Older adults with dentures, mouth sores, recent dental treatment, or fragile oral tissue should be cautious. There is another problem rarely mentioned. Repeated numbness can hide irritation. If the area begins to feel less painful, a person may assume it is becoming healthier, when the sensory effect is simply making the discomfort less noticeable. Pain and irritation are not always enemies. Sometimes they are warning systems. If your mouth burns, swells, develops sores, or remains numb, remove the clove, rinse gently, and seek professional advice if symptoms persist or become concerning. Does this mean cloves have no place in a healthy life? Not at all. Used as a culinary spice, cloves can add strong flavor without sugar or excess salt. They can be included in soups, stews, teas, or recipes in modest amounts. Their aroma may make food more enjoyable for someone whose appetite has faded. But enjoying a spice is different from assigning it the job of opening arteries, treating diabetes, or preventing a heart attack. Here is the safer and more honest way to think about the 5-minute clove claim. First, recognize what you may genuinely feel: a spicy taste, warmth, tingling, salivation, mild numbness, or irritation. Second, recognize what you cannot feel or confirm from that sensation: improved platelet function, increased nitric oxide throughout the body, reduced arterial plaque, lower blood sugar, or protection from a cardiovascular event. Third, ask what symptom led you to try the remedy. That question may be more valuable than the clove itself. Are your hands and feet cold only in winter or every day? Is one foot colder than the other? Does the skin change color? Do you have numbness, wounds that heal slowly, or pain while walking? Are you unusually tired, short of breath, dizzy, or weak? These details help a clinician think about circulation, nerves, thyroid function, anemia, heart and lung health, medication effects, and other possibilities. Urgent symptoms should never be managed with a spice ritual. New chest pressure or pain, severe shortness of breath, fainting, sudden weakness on one side, trouble speaking, or a suddenly cold, pale, painful limb require emergency help. The goal is not to make you afraid of every sensation. The goal is to make sure a comforting internet claim does not silence an important alarm. For everyday circulation health, the habits with the strongest practical value are usually less dramatic. Move regularly within your ability. If your clinician says walking is appropriate, build it gradually. Avoid sitting still for many hours. Manage blood pressure, blood sugar, and cholesterol with an evidence-based plan. Do not smoke. Eat a varied diet with vegetables, fruits, fiber-rich foods, adequate protein, and appropriate portions. Sleep consistently. Take prescribed medication as directed. Ask for help when a symptom changes. These actions do not create a burning sensation in 5 minutes, so they are harder to sell in a dramatic video. But health is often protected quietly. A 10-minute walk repeated most days can matter more than a powerful tasting ritual performed once. Taking blood pressure medicine correctly may feel like nothing, yet it may reduce risk. Showing a doctor the wound on your toe may be uncomfortable, yet it can protect your mobility. The absence of a dramatic feeling does not mean the absence of benefit. Thomas learned this slowly. His daughter began walking with him in short, manageable intervals based on professional advice. He followed up on his test results, reviewed his medicines, and paid attention to patterns instead of promises. He still kept cloves in the kitchen, but now he used them to flavor tea and a stew Margaret used to make. The spice became part of a memory, not a substitute for medicine. One Sunday, his granddaughter asked why he had stopped putting a clove under his tongue. Thomas smiled and said, "Because feeling something is not the same as fixing something." That sentence is worth remembering. A tingle is not proof of improved circulation. Warmth in the mouth is not proof of younger arteries. A calmer feeling is not proof that blood pressure or glucose has changed. Your experience is real, but the explanation must still be tested. If you are healthy, use cloves normally in food and enjoy them without expecting miracles. If you want to try holding one whole clove briefly in your mouth, understand that there is no established 5-minute circulation protocol. Do not use essential oil. Do not swallow a whole clove if choking is a concern, and stop if it causes burning or irritation. People who take blood thinners, use diabetes medication, have liver disease, have an upcoming procedure, experience swallowing problems, or have sensitive oral tissue should ask a healthcare professional before making concentrated clove products or repeated medicinal use part of their routine. Most importantly, do not let a clove become a reason to delay care. The most powerful decision Thomas made was not placing something beneath his tongue. It was finally describing his symptoms honestly. That conversation gave him something the viral video could not: a plan based on his actual body, his actual risks, and his actual life. There is something deeply human about wanting one small answer. Aging brings enough uncertainty. A jar in the kitchen feels familiar, a 5-minute promise feels manageable. But you deserve more than a promise built from scientific words arranged to sound certain. You deserve the truth, even when the truth is less exciting. Cloves contain interesting compounds, but the under-the-tongue circulation breakthrough has not been established by strong clinical evidence. The sensation may begin quickly. The claimed transformation has not been proven. So tonight, before trying the newest health trick, ask 3 questions. What evidence shows that this exact method helps people like me? What are the risks with my medicines and conditions? And what important symptom might I be avoiding? Those questions can protect you from both unnecessary fear and false reassurance. If this video helped you see the difference between a biological possibility and a proven treatment, press the like button and subscribe to the channel. Share it with a friend, parent, or neighbor who believes that a strong sensation means a remedy is working. And write "truth first" in the comments so I know you stayed until the end. I am Dr. Ryan Coldridge. My message is simple: respect natural foods, respect modern medicine, and respect the warning signals your body gives you. Use cloves for flavor if they suit you. Do not use them as a replacement for diagnosis, prescribed treatment, or emergency care. Your heart, your circulation, and your future are too important to hand over to a 5-minute promise. Take care of yourself, stay curious, and never confuse a dramatic claim with a medical fact. I will see you in the next video.